Why is the ICU the only nursing experience that's accepted for CRNA school? There is a common misconception that what's important is the procedures you do or get exposed to or the drugs that you push. It's really not important for CRNA school. We can truly teach anyone to intubate. Truly such a small portion of what we do during our day. The main point of being a CRNA, the most important part of our job, is the ongoing management and decision making that comes with caring for a patient under the influence of anesthesia. That means an intimate knowledge of pathophysiology of every single disease process that your patient takes with them into the operating room, of all of the procedures they're having done, an in-depth knowledge of pharmacology of every single drug they're on at home, that they're receiving in the hospital, and yes, the ones that you yourself are giving in the operating room, an in-depth understanding of hemodynamics because they're drastically affected by anesthetics, and an in-depth knowledge of how fluid shifts, blood loss, blood product administration, fluid administration, all affect those variables as well. The ICU is a great opportunity to lay a foundation for those things because you are forced to sit with critically ill patients for days, weeks, even months on end sometimes because you're titrating them on and off for, again, days to weeks to even months. In the ER, most patients are up and talking and walking. Yes, you can get acutely unstable patients, but even when you see them, typically you're stabilizing and shipping. And yes, that's a very important skill set, and it absolutely translates to the operating room. But it does not give you the opportunity to wrestle with the in-depth patho and pharm that we really, really need in the OR. Now, do some ED nurses get this experience anyway because they're at super busy level 1 traumas? Absolutely. And those people do move on to get into CRNA schools. Same goes for flight nursing. There are definitely flight nurses who routinely care for critically ill patients on long transports, are able to really prove their skill set and get in for sure. But they are the exception and not the rule. If you are an ED nurse in this position, you're interested in becoming a CRNA, I do encourage you to just make the jump, go to the ICU, and after 6 months, start applying to CRNA schools. Because by the time you interview, you'll be at the 1-year mark and you're going to be a really well-rounded applicant. You're going to find it really enhances your knowledge and takes it to a new level. This is why we spend so much time on in-depth pathophysiology and pharmacology in Confident Care Academy, by the way. Showing you have an in-depth understanding of these processes is the key to standing out and the only way to get in right now.